Hi, Dr. Ramsey Choucair. Today we're continuing our video series to educate patients about cosmetic surgery. Today we're talking about our mini-facelift under local anesthesia with oral sedation. This has become a go-to procedure for patients who have early facial aging, who, in my opinion, are not going to achieve the results they want with the multiple non-surgical treatments out there, whether it's ultrasound or radiofrequency. There's so many new techniques that are purported to tighten the tissues for early aging, and I've tried most all of them and have abandoned them only because we never seem to achieve what the patient truly expects from those non-surgical treatments. So why do a mini facelift? It's surgery. Well, it is, but it's something that has become accepted so readily in our practice that we really feel like it has become a significant benefit to patients. First of all, you have to get patients to overcome the fact that it's surgery. But we do it right here in our operating room with them walking in the operating room. They take a little oral sedation, have a loved one drop them off. They're talking to us as they're sitting here. Then I put local anesthesia along the incision while we're speaking. And then usually they'll drift off to a light sleep or continue to talk while we do this 2 to 2.5 hour mini facelift. And again, the key is that they're achieving the elevation of the tissues that have relaxed in the most optimal way, and the recovery is relatively quick, meaning they typically will go home that afternoon after having the procedure, have a normal meal, do normal things. They usually have minimal pain. Most patients will take a Tylenol or maybe a slight narcotic painkiller for one night, and the next day they drive and they're out and about. Now, if their hair doesn't cover, they do have suturing or stitching along the edge of the ear, which stops here. But most patients can put makeup on and go to the grocery store if their hair covers their stitches, which we remove at 5 or 6 days. Again, there is typically very little discomfort. And the 3 principles we always talk about: we maintain hairlines, so there's no distortion of the hairline. We make sure the pull is gently upward, so there's no distortion of the corner of the mouth, and we make sure the earlobe is not pulled down. The 3 principles we always talk about that keep a facelift looking normal. So when patients find out and get over the fact that it's surgery, they are universally pleased that they elect something like a mini facelift with local anesthesia and oral sedation instead of many times spending more money doing non-surgical techniques that really create minuscule improvement. Hope that helps you understand our mini facelift.